Regarding breast lifts, one of the things that I think is most confusing to a lot of patients is trying to figure out whether or not they even need a breast lift and if it applies to them. There's a number of factors that go into determining if someone needs a lift and if they're a candidate for it. And the general kind of concept of a breast lift or a mastopexy is based on the position of the nipple. So a youthful nipple is either at the position of the inframammary fold, which is the fold underneath the breast, or it's slightly above that fold. And through aging, through breastfeeding, through weight loss, and just over time with gravity, the breast and the tissue and the nipple tend to descend. And the nipple can be either lower than the level of the folds or even pointing straight down. And with each of these nipple positions, there's a number of different ways of doing a lift, and each of them address a different factor. Another common question that people often ask, which is I think a great one, is will my cup size go down with the breast lift? Interestingly, there was an article that was published in 2014 in the Plastic and Reconstructive Surgery Journal that addressed this very issue. They found that generally the women in the study had decreased by about 1 cup size. But the reality is, and the paper addressed this too, that most women that have more ptotic or more sagging breasts are actually wearing a bra size that's not even correct for them. They're wearing 1 cup size up to accommodate the fact that their breasts have descended. And in reality, when the breasts undergo a breast lift and they are more condensed and they're in a more youthful position, that's probably a more accurate representation of the bra that they should be wearing. So hopefully this answered some questions. Keep sending them in. Great to ask and great to answer because a lot of people have really similar questions. Until next time.